let's talk about sex.
He's been sitting here.
And when we no longer allowed to do this show because you got this guy on, I just want you to know it's not my fault.
This guy is one of my favorite people.
Okay.
This is John Hettiarachchi. Did I say that right, John?
Perfect.
Hey,
Wait.
I got it.
Wow, that's pretty impressive.
Well, you gave me the clue. It's like Liberace except with an H.
Right.
Hettiarachchi.
Hettiarachchi.
With Charlotte Center for Pelvic Health. Now, part of what we want to understand, we certainly want to understand what you're doing, but you already have another business.
Correct. So
that you're in, and you've decided to start something new, which is an interesting, very interesting process. Tell us a little bit about that.
Well, I finished training in New York as a urologist about 13 years ago, and Wilkes County needed a urologist. They were losing about 70% of their patient volume. So they recruited me, and for the past 13 years, I've been there under Piedmont Urology. So I'm a successful urologist doing a lot of female urology work, which is incontinence, sexual function, prostate work, vasectomy, stones kind of things. And then I was at a meeting about 3 months ago, and I'm at this meeting in New Orleans. And there's a presentation who's a thought leader in female urology. He's a kind of world-famous urogynecologist in Cincinnati called Mickey Cram. And he presents his information and data about this new laser that has come out of Italy. And amazing results for women who are going through menopause and cannot take any estrogen therapies for vaginal pain, vaginal dryness, incontinence, recurrent bladder infections. So then I'm like, this is very intriguing. I go down to the booth where they're vending this $200,000 laser. And I said, Kai, my wife was in the room upstairs in the conference area. I said, can you just Google this? I think I'm curious. She calls me back 5 minutes later and says, John, you got to invest in this. This is the hottest thing for women. There is nothing for a woman out there. And the man will be happy at the end of all this because it's a relationship builder. If your wife or your significant other is complaining about things and they're not happy and you can't have intimacy, it's a drag on a relationship.
Well, that's interesting. So it was your wife that kind of got you into that because you've got a successful business.
Correct.
And to decide you're going to start something new is building a mountain that you get to climb that you didn't have to do.
Correct.
You know?
And so, I've been married 25 years. When my wife tells me something, she rarely tells me to do something. I have to sit up and listen. So then we went through the due diligence of researching the product, talking to Dr. Cram, going to training, buying this new laser, and setting up a boutique office in Cornelius. And I've treated multiple women which have had amazing, life-changing results.
Let's talk, because so many people miss the point, and I say this often here, that professionals, doctors, lawyers, attorneys, dentists, so many of these professionals are small business people. So talk a little bit about the process of starting this private practice in obviously a unique new setting. Talk about that, because it really is starting a new business.
You're in a new location and everything else.
Correct. So what's happened in medicine in the U.S. is so many insurance changes, Obamacare, Medicare. Most physicians are owned by a major hospital system, Novant, Charlotte Health Systems. There are very few solo practitioners running their own practice because it's cost ineffective. So if a patient comes and sees me, they pay 1/2 the price when they go to a physician owned by a major system like Novant. I mean, so there's a cost savings in going to a small business. So I want to remain viable. I like to do what I like to do. I like to take vacations. I don't want the man to tell me, you don't really need to buy this equipment. It doesn't make sense to you. And so there are no physicians in Charlotte with this product, but it's a life-changing procedure for women. So I want to offer a service which I believe in and will keep me viable as a solo practitioner in this day and age.
So can you do both? Can you work for the man at the doctor at the hospital and also do this, or you've got to choose?
Well, I can do a part-time gig if I want to. So I have both of my practices are privately owned. So When I have one that is more of a boutique center and cash paying, and then the other managing health insurance with declining, revenue
Sure.
and high 60% overhead, I've got to offset those balances. I mean, exactly what you're telling me this
Right.
morning is exactly what I'm doing in my two practices.
Right.
Now, there is a lot of startup costs. We went through the models. We're going through the process of advertising and talking to all the right people and educating people on what we're doing, because there is no one else. It's a niche market.
And that is the hardest thing for a small business person to do, is to introduce a new product or service to the market. Here's where we are. You're the successful doctor. You are strategically looking for another independent avenue to create some revenue, which I love. You find this product and service, just like all of us small business people would do. You figure out the cost. You run your projections. You set up your space. And now you've got to let people know about this new product and service. Talk a little bit about how you started doing that, because it's not easy to do, to introduce something new to a market.
Sure. So we went to Lake Norman Chamber of Commerce. We had a ribbon cutting. But the pivotal thing I found out was just networking with the Lake Norman Small Business Group. On Wednesdays, we're meeting about 60 people, discussing other entrepreneurs out there doing their services. So I've used some of their services in my practice, such as advertising. Advertising, it has come through. Should be starting with Lake Norman Women's Magazine. One of the ladies from that small business network has worked for Dex, and now we're getting a web presence, creating our SEO, which is tweaking our web presence, so we have the patients needing our services being brought to us as they're putting in certain keywords, such
Right.
as painful sex, vaginal pain, vaginal dryness, menopause, recurrent bladder infections. Other things we've talked about, but I don't think it's going to be cost effective, is billboards. I've run through some local newspaper in our areas.
Right.
And I'm not sure newspapers was effective for us. One thing that I did notice was I wrote an article, and we've had some patients come and tell me, my husband read the article. He told me to come in here because he describes you right there, So, I'm trying to write a majority for the women, but the men are driving some of these. I had another patient the other day come in and say, you know what? I had to bring my wife in. I come and get treated for low testosterone through you, but then I heard about you doing this. We're having a real problem with our relationship because of this function. And a young 40, 50-year-old couple, it's a big part of their lifestyle.
There are a lot of different kind of businesses, and what's one unique thing about yours, not totally unique because there are others, but you don't have competition, so it's not a question of how are you better than someone else doing the same thing. You said it earlier, it's about educating. It's about letting people know what you've got and describing very clearly who it is you can help and how you can do that. So
I don't know that I agree with that, because you do have competition. It's just other choices, because this is so new.
Well, there's no one else that does what he does.
That's correct. But there's other things they can do to try and solve this, correct? This is just, you're saying this is a better way to do it.
No, I mean, what typically happens, women are on estrogen creams, which have side effects of blood clots, breast cancer development. So women who have breast cancer treatment are survivors cannot take any more estrogen. So that's a huge segment of women that can have these problems, pelvic vaginal atrophy, and then the laser treats them back to what they were prior to any kind of breast cancer treatment. There are a lot of other women that just don't want to take medication.
Right.
They $400 for 3 months supply of medication versus a treatment that can fix the problem.
Right. You set up your office and you've spent all this money, and there's this equipment, this new laser stick or whatever you want to call it. Do they not help you do some of the marketing or make some suggestions for you? I mean, in other industries, these
Right.
manufacturers would help you with that. It sounds like they're not helping you with
Right.
this.
I'm very disappointed because their goal is to sell more laser products.
Right.
And you would think they would
So they're selling you.
champion with us. But the problem is I'm the only guy in Charlotte. They want to sell more stuff in Charlotte.
Right.
So they want to keep me contained until they can get some more stuff out there. It doesn't. If you Google this MonaLisa vaginal atrophy, it has one of the highest success rates and satisfaction scores in medicine. 95%, and they can sell this left and right.
Right.
They just need to. They're having a hard time because Charlotte is so controlled by big organizations.
Yeah.
You have to find a solo practitioner willing to take a chance.
Right. I got you. So do you buy a certain area, or they could sell something somebody could open up right next door if they wanted?
Theoretically, they said I can have like a 30-mile area, but who's really gonna
Right.
give me that in the future? It's just
Right.
Because
a
it's more
theoretical
the
thing.
equipment they sold
Correct.
you rather than a franchise area.
Correct.
And I really want people to hear this because you really do. These are the exact same challenges that small business people run into all the time. Now, okay, we have beat around this thing. Let's make sure people really understand exactly what this procedure is and exactly what it can do to help. Because I've been on your website and I've clicked on the videos. So do your best to sort of describe to the women out there, and I guess the men out there, exactly what this is.
Okay. So after menopause, as vaginal atrophy occurs, the vaginal lining becomes very thin. It tears very easily. It's dry during sexual activity. There's changes in the pH, which sets up women for recurrent bladder infections. Incontinence occurs more. So this treatment is a 3-minute treatment. We put a vaginal probe, which is a small probe, into the vaginal canal very gently. We fire the laser, takes 2 minutes, and a woman comes back for 3 treatments. After 1 or 2 treatments, there's already a change in vaginal moisture. I've already had patients come back and say, I'm having amazing relations with my partner. My frequency, urgency, incontinence have improved. What this laser does is rebuilds collagen, makes the vaginal canal thicker, folds better, more moisture, better vaginal epithelial lining, more collagen, so we have better control of incontinence in the future.
It is as simple as sticking this stick up there, squirting some Kool-Aid in there, and they're better. I mean, you are
Correct.
making it sound that simple.
It really is.
And that's what the video looks like when I
right.
see
It really is. Everybody leaves my office saying, wow, that's really nothing. I didn't have any pain.
Doc, we're running out of time, so let's make sure they know how they can reach you. And you've also got an event coming up that you want to talk about.
Correct. So I have, you can reach me at MonaLisaCharlotte.com. That's MonaLisaCharlotte.com. Our event is on
May 19th.
May 19th at 6 p.m. to 7. We're going to have a free giveaway for a potential patient. And then we're going to have some patients who have treated telling their experience and their results. So it's not just information. We're going to make it interactive for the patients and potential. And we wish all the patients as well as their partners to come to hear this, to how effective this product is.
And it obviously sounds painless.
No anesthesia. No, it just feels vibrations in the vaginal canal. That's really it.